Wakenya wenzangu, hamjambo. I write this not as a politician. I write as a doctor who treats your mothers, your fathers, children, and neighbors every day at MTRH. I have buried patients who died not of disease, but of delay. Let us talk honestly, respectfully, and together, because health is not about government or hospitals. It is about you. Part 1. What is SHA and what is NESP? Let us start with facts. 1. SHA, Social Health Authority. This is the new health insurance for all Kenyans. It replaced NHIF in October 2024. The goal: universal health coverage, that no Kenyan should be denied treatment because of money. As of August 2025, 25.2 million Kenyans registered. Now 32 million have registered. SHA has paid 56.4 billion shillings to hospitals. 2. NESP, National Equipment Service Program. Launched August 2025 by President William Ruto. A 7-year program. The goal: put modern machines in public hospitals without counties paying upfront. And this is how. Private companies called quote-unquote vendors bring CT scans, MRI, dialysis, X-ray, theater tables, anesthesia machines, cath lab machines. They install and maintain them. SHA pays the vendor every time a patient uses the machine. Progress: 7.3 billion shillings already spent. 213 hospitals in 43 counties have new equipments. NESP is a good idea. SHA is a good idea. The intention is right. Part 2. Why are public hospitals struggling? The 100% versus 5% versus 0% problem. This is where pain is. Let me explain simply. Scenario A. Private and faith-based hospitals. They serve, they receive, their burden. That is, they serve versus they receive versus their burden. They serve 20 to 30% of Kenyans. They receive 100% of SHA payments. Their burden: they choose patients. No emergency mandate. Scenario B. Public level 5 to 6 hospitals. Kenyatta National Hospital, MTRH, and county referrals. They serve versus they receive versus their burden. They serve 70 to 80% of Kenyans and all emergencies, plus all referrals. 5% after. 90% goes to NESP vendors, 5% goes to KEMSA drug debt. Public hospitals pay 100% of all cost. That is electricity, water, food for patients, fuel, cleaning, casual workers, salaries, medicine, and service of the government machines by consumables. Examples with real numbers. Annex 2. CT scan. SHA pays 6,900. Vendor gets 6,210. And the hospital gets 690. Dialysis. SHA pays 10,650. Vendor gets 8,660. Hospital gets 1,990. MRI service contract. Cost 5 million per year. Hospital gets 1,100 per scan. The real question: can 690 pay electricity, radiographer, cleaning, and machine service? No. Part 3. The capitation killer. Quote unquote, we work for free. For basic services like X-ray, ultrasound, lab test, OPD, SHA uses quote unquote capitation. How it works: SHA pays Are NESP vendor 100% to provide X-ray machines? 2. You come to public hospitals with SHA card. 3. Hospital does the X-ray but gets 0 shillings. 4. But hospital must still pay rent, security, radiographer salary, electricity, room cleaning. We are paying 100% to provide a service we are paid 0% for. No business, no hospital can survive like this. That is why queues are long. That is why machines are off. That is why our computers, scanners, our ICT systems are slow. That is why our oxygen supplies is erratic and cost lives. That is why our leaders, senators, MPs shift the blame on poor services to governors, board and management over poor services. Part 4. From NHIF 36 billion to SHA 5%. Under NHIF, public hospitals were owed over 36 billion Kenyan shillings. Payment was late to public hospitals, but at least the full amount was supposed to come. Under SHA, payment is faster, but we only receive 5%. The rest goes away fast to vendors and DHA KEMSA. So we moved from quote-unquote dying of debt to quote-unquote dying of arithmetic. Part 5. Why are drugs and dialysis consumables missing in level 5 to 6? 1. KEMSA is paid upfront before SHA verifies your claim for essential medicines, but not cancer, transplant, heart, interventional radiology. 2. 90% goes to vendors first. Only 10% left and then 5% after KEMSA. 3. Result. No money left to buy transplant drugs, cancer chemo, dialysis consumables, food, pay for oxygen, salaries, security, environment, and water. That is why they are quote-unquote not available in many public hospitals right now. Part 6. The silence and misinformation. 1. Leaders, many county governors, MPs, CEOs are silent for fear of losing favors. 2. Unions and associations. Some negotiate allowances instead of fixing the system. 3. Citizens. Most Kenyans don't understand SHA. Politics and misinformation fill that gap. 4. Result. We are choosing to weaken public hospitals that serve the poor to favor facilities that can choose services and patients that make more money. This is not about blame, it is about truth. Part 7. The Tugen Alps Shop Lesson. Mzee Chesomet once said, and I quote, "A shop that pays rent, salaries, electricity, but sells another man's goods and only keeps 10 shillings will die." That shop is our public hospital. The shelves are empty. Part 8. The solution. Things we must do together. We are not against SHA. We are not against NESP. We want them to work. For government. 1. 70-30 model for public hospitals. Pay 70% to hospitals, 30% to vendor over 10 years instead of 7. 2. Ring fence 2 funds. 1 for hospital operations, 1 for NESP machine service and chronic drugs. 3. Pay for capitated services. Pay hospitals fee for service for X-ray, lab, or increase capitation 5 times. 4. Transparency. Publish the list of NESP vendors and rates. Let hospitals board sign the service agreements. 5. Pay KEMSA quarterly, not per patient, so drugs don't stock out. For leaders and unions, speak truth. Protect CEOs and CECs who tell the truth. Oversight, not silence. Fight for the system, not just allowances. For all Kenyans, health education. Learn what SHA covers. Ask questions. Go to level 2 to 3 for checkups. 9. Prevention. Check BP, sugar, cancer early. It cost 5,000 to prevent. It cost 5 million to treat kidney failure. Reject misinformation. Verify before you share. A nation that eats its seed will have no harvest. Final word to you, Mwananchi. Mr. President CS Duale, governors, NESP and SHA are your legacy projects. We support them. But 7.3 billion shillings in machines will become scrap metals if we don't give hospitals money to switch them on. To you, Mwananchi, your SHA card is real. Your right to health is real. But if we don't fix how money flows, the hospital near you will have a machine, but no power, a doctor, but no medicine. Kidole kimoja kivunji chawa, lakini vidole 10 vinaweza kujenga taifa. Let us build this together with truth, with respect, with solutions. Asante sana. Mungu abariki Kenya na Wakenya wote. Dr. Cheptinga K. Philip, Chief Nephrologist, MTRH. I treat kidneys. Today, I'm asking us to treat the heart of our health system.